Hi, Zenadine. How are you?
How are you, Dr. Jason?
Very
Thank you
good.
so much. Okay, so let me admit the participants. Okay, we'll wait just for 2 minutes for participants to join us, and then we can start.
Sure.
Hey, Dr. Jason, it's nice to meet you.
Hi there. Nice to meet you too.
My name is Laith. I'm a third year student, medical student in Al Quds University. I only watch for BnB. You're the best.
Thank you. I appreciate that, Light.
And thank you for your lectures and your efforts.
My pleasure.
The medical school system here, especially in the Arab world and Middle East, we have a 6 years medical school program. So
Okay.
three preclinical and 3 clinical years for students. And in the preclinical years, like we have around 1.5 year where we cover the general principles like general pathology, general biochemistry, general anatomy. And then we go forward into the systemized approach. Starting from the second semester of the second year, we will start with the cardiovascular system, the respiratory system, system after system. After the third year, we start our core clinical rotations, mainly internal medicine. Like we have the system here, like in Palestine, we have majors and minors. So in our fourth year of med school, we get, for example, two majors, which are internal medicine and surgery, and a bunch of minors like urology, ENT, ophthalmology. In our fifth year, the two majors are obstetrics and gynecology, in addition to another group of minors, which are psychiatry, neurology. And finally, in our sixth year, we repeat those core clinical rotations. So we repeat internal medicine, obstetrics, pediatrics, and internal medicine, but like in a more advanced form. Like we more focus on diagnosis in our fourth and fifth year, and we focus more on treatment in our sixth year. So just like to give you an insight on how is the medical education system here in Palestine. And interestingly, this session is not only attended by Palestinian medical students. We have many students from 6 Arab countries. We have from Morocco, we have from Algeria, from Lebanon, from Jordan, all fans of Birth
Wow.
and Beyond. Yes, we got on our Google form 220 applicants, which wasn't actually a surprise. And we're truly honored to have you today, Dr. Jason. Me personally, I used your Boards and Beyond course and I passed my USMLE Step 1 on age 20. So it was really beneficial because like the thing that was different in your Boards and Beyond course was that it doesn't like for example, it doesn't make you just rote memorize everything. It makes you understand the concept behind everything, and this is what I really like about your videos. So yeah, basically, you're my fan.
Thank you for that. And thank you for the background on your university. That's very helpful. I really appreciate that. A couple of quick questions. Where do most of the graduates go afterwards to, do they go to do more training? Where do they go to practice? And Do you take step one only if you're wanting to go to the United States, or do people take step one for other reasons?
Well, we take it for multiple reasons. So, first of all, many students, especially here in the Arab world, believe that the curricula of the United States medical licensing examination cover a lot of the aspects that, like, we believe that we sometimes not cover fully in our education system. So, sometimes many students just study for the USMLE materials even without taking the USMLE exam because it helps them to understand medicine more and to understand the aspects that is needed. So many students use boards and beyond first aid for their own, for example, for their own a clinical examination at med school, even if they are not applying for USMLE. Regarding USMLEs, we primarily most students who apply for USMLEs apply for USMLEs in order to get a match into United States and US residency. As some other students go to use it like in Qatar. In Qatar, they accept USMLE Step 2 CK. In Israel, if you have, for example, USMLE Step 1 and Step 2 CK, you can work there as a physician. You are licensed and you are waived the
هذا
Israeli.
دكتور استنى شوي
If you could
عشان
please.
اشرح لك.
Okay, sorry. So again, yes. So like in Israel, if you have USMLE Step 1 and Step 2 CK, you can practice there without with a waiver of requirements for the Israeli Medical Board. So there are actually multi-purposes, and we, especially in this region, we face many like resource constraints and status. So many of us are looking toward many other options. Some students surprisingly apply for the USMLE and for the USMLE examinations just solely to like to put it in their CVs that they've passed the USMLE, since they are the hardest medical examination in the world. So yes, that's basically we're mostly students. But for the vast majority of us, yes, it's mainly to match into the United States. Most of our students match into internal medicine, but some many of other students match into surgery, neurosurgery, some psychiatry. Like we have a colleague who matched into neurosurgery this year, and
Wow.
United States of America. Yes.
Amazing. Okay, that's very helpful. Thank you for letting me know. And thank you all for having me. It's a pleasure. I love meeting people who watch the videos. Obviously, I spend a lot of time making them, but I don't interact with you very much. So it's always so nice to see you live and in person and hear your questions and talk to you.
Thank you, Dr. Jason Ryan. So I'm gonna allow the floor to my colleague Muhammad Riddad. So he will start the introduction, so we could start our session for today. We're truly honored to have you, Dr. Jason.
Thank you. Thank you for having me.
Hello, everyone. So, Dr. Ryan, it's truly an honor to have you with us. But there's a lot of students who didn't join yet. So, while we wait for everyone to join, I also want to briefly introduce Jerusalem, since we have a lot of international students with us. CARDIG-Jerusalem is the cardiology interest group of Jerusalem. CARDIG-Jerusalem is a student-led initiative based at Al-Quds University that focuses on creating opportunities for medical students who are interested in cardiology, medical education, research, clinical skills, and leadership. Our goal is not only to help students learn cardiology in a stronger and more practical way, but also to build a supportive academic community where students can connect, grow, and engage with physicians, educators, and opportunities from all over the world. Over time, Cardigs has organized different educational activities, workshops, simulations, awareness events, and collaborations. And today's session with Dr. Jason Ryan is one of the opportunities that we are truly proud to bring to students internationally. And for anyone interested in learning more about Cardiog-Jerusalem, we'll also be sharing our website and social media pages in the chat in the session. So for everyone joining us today from different countries and university, we're really happy to have you here with us. So Zain, I guess we can start right now.
Sure.
Yes, go ahead.
Hello, everyone, and welcome to our session today. Dr. Ryan, I have to say, it feels a bit surreal to be the one saying welcome to the module while you're the one on the other side. For so many medical students around the world, your voice has become part of the journey of the medical school itself. Late nights before exams and difficult concepts that suddenly started making sense, moments of stress when things felt overwhelming, actually. Your teaching has generally been present in those moments for countless students. And I think what makes your impact special is that you didn't just teach medicine, you taught it in a way that made students feel capable of understanding it. For many of us, especially international students, boards and beyonds became more than just a resource. It became structure during chaos. It became honestly a source of confidence during some of the hardest periods of training. So, on behalf of medical students all over the world, board, I guess, thank you. I want to say thank you, not only for being here with us today, but for the work and the effort you've put into making medical education more understandable, more accessible, and more human. Today, we are really excited to go beyond the videos and beyond the modules to get to know the story, the mindset, and the journey behind it all. So, welcome again, everyone,
Thank you.
not to an immunology module or a cardiology module, but the story of Dr. Jason Ryan module. So, truly, Dr. Ryan, it's an honor to have you with us today.
Thank you. I really appreciate those kind words. Thank you so much.
So, everyone, I'd love to start with from the very beginning, Dr. Jason. Um, Dr. Jason, before medicine and before cardiology and before boards and beyonds, who was Jason Ryan and what led you from chemical engineering toward medicine?
Yeah, thank you. That's a very good question. And my journey, like a lot of people, was not a straight line. So if you take anything away from my story, it's that there's always chance to be reborn and recreate yourself in life. There's many opportunities for this. My parents both have advanced degrees in chemistry. So when I grew up around the dinner table, they talked about their studies. My father has a PhD. And so when I started to study chemistry in high school, I had a natural interest in this. It was familiar to me. It was something I'd heard a lot growing up. And so when I applied to college, I looked into different majors and I decided to major in chemical engineering. It was a difficult field, but it had at the time very good job prospects coming out of college, and it fit with sort of my background from my family, and so it just made a lot of sense. So I studied chemical engineering in college, fully intending to graduate and go practice as a chemical engineer for the rest of my career. I worked for a year after college for a company that makes plastics, small plastic pellets that can be molded into anything. And the job was fine, but it wasn't really right for me. It was a lot of cubicle work. It was very independent. Um, and I sort of saw the way my career would go if I stayed in chemical engineering. And I knew a lot of people in college who were pre-medical students. They were in a lot of my classes because I took pre-med classes like organic chemistry and physics. And so I'd always thought that that was too much school to go to medical school. But once I saw what the working world was like, I started to realize the benefits of education if it gets you to a place where you really want to be. And after that year of working, I sort of wasn't afraid of more schooling if I knew that at the other end there would be a very satisfying career. So I started to look into medicine. Honestly, largely because it was something I thought I might enjoy, and it's such a very secure field in the United States, very good job security, good salaries. And so the more I looked into it, the more it seemed like something I would enjoy. So I applied to medical school, and 3 years after graduating college, I went back to school for medicine. And that was the start of my path towards being a doctor and sort of the end of my path as a chemical engineer.
Yeah, that's really interesting, Doctor. Thank you. So, taking that a step further, out of all medical specialties, what made cardiology feel like the right path for you?
Yeah, this is always one of my favorite questions to answer. So when I started medical school, I didn't even know what cardiologists did, and I didn't really understand the difference between cardiac surgery and cardiology. I was confused, which a lot of people are. But as a third year medical student, I had a medicine rotation, and one half day a week, we were assigned to a specialty clinic, and I was assigned to cardiology clinic. And that was the first time I really it clicked what cardiologists do. And to me, it was a exciting mix of different things in medicine. It had a lot of old-fashioned medicine. You had to take a careful history, you had to perform a careful physical exam. These are things that have been around for hundreds of years. And then it had a lot of cutting edge medicine. We were looking at echocardiograms, we were looking at nuclear stress tests, we were obviously looking at EKGs. So that mixture of old fashioned medicine and new medicine, I really liked. There was continuity with patients too. Patients really knew their cardiologists, they knew them over many years. This was nice. And then I like the acuity. This is something you always have to ask yourself, but I always felt more comfortable being the person that gets called rather than being the person making the phone call from the emergency room. Emergency medicine is a great specialty, but like it was never for me. I wanted to be sort of the expert who knew everything and who took the patient out through the hospital and then saw them in follow up and saw them down the road. So the fact that people had high stakes disease in some cases that needed treatment over many years, this was attractive to me. So that combination is really what first got me to think about it. Now, I loved so many medical specialties. I was not one of these people who just hated certain things and loved certain things. I mean, I loved surgery. I loved OB/GYN. I'll never forget delivering babies. That's one of the most amazing things. I hope everybody gets to do it in their training. I liked psychiatry. I liked pediatrics. But, as all time went by, I kept comparing these things and the lifestyle and what I'd be doing every day. And cardiology just continued to win out.
Thank you, Doctor. From your answer, I understand that you like to have things under management and everything should be manageable. So, speaking of making things more manageable, when you created Boards and Beyonds, what problem in medical education were you trying to solve, actually?
Yeah, the drive to make Boards and Beyond really came from my students. At the time I created it, I was giving traditional 1 hour lectures to University of Connecticut medical students. We had a traditional curriculum. I taught a couple of things. I gave some sessions on EKGs, some sessions on anticoagulant drugs, and the students told me some of the things you said, that my teaching was easy to understand, that they liked the way I taught. And that they wish they could have teaching like that for many more subjects than just the couple of hours where I was the one giving the lecture. So that was really the impetus for it. I started to think I could, in this at the time, it was about 2014. It was very easy to record videos from PowerPoint slides. I had been a chief resident when I was in internal medicine, so I had all these PowerPoint presentations on different topics in pulmonary, renal, cardiology, and I thought, well, I can just record these, and put them on a website, and this would potentially fill a need. Students were watching Pathoma at the time. It came out a few years before Boards and Beyond, and it was so popular, and that made me think that this model of teaching, creating videos, putting it up on the internet could catch on. And so that was really the idea, was to just take my teaching, which the students told me they really valued, and try to get it out there more than I could. In a curriculum, you're limited by you only teach this and someone else teaches that. The Boards and Beyond let me teach whatever I wanted to. And for me, that was fantastic.
Thank you, Doctor. I guess, yeah, I already said that I guess what's special about your teaching is that you make us understand it, not only know how to memorize medicine or something like that. No, it actually connects us to medicine. So, Doctor, I have another question about this matter. From your experience teaching thousands and thousands of students, what do you think is the biggest mistake medical students do when they are studying?
Yeah, so it sort of depends what you're studying for, but a lot of people want to know what mistakes to avoid when they're studying for step one or step two. And really, one of the biggest changes between now and when I was in medical school is the availability of practice questions. I mean, I studied for step one, if you can believe it, with no practice questions, no Q banks. I just had to read from a textbook and then I would map it out on the whiteboard to make sure I could remember it. But as you know, you can understand something really well and still get a question about it wrong because you haven't seen it presented in the way it's presented in a tricky question stem or something along those lines. So nowadays, there are so many great Q banks. I mean, first of all, there are the NBMEs, which are retired step questions. So those are just a must do. Those are questions that were once in circulation on the actual exam. And then there are AMBOSS and UWorld questions, which are excellent standalone Q banks, and Boards and Beyond has questions that go with the videos that you can take after you do it. So, I've tutored students who failed step one or delayed it because they were at risk of failing. And usually the most common thing I find is people are watching too many videos and not doing enough practice questions. The videos are really helpful for laying a foundation. I mean, if you've never heard of heart failure, you should watch a video on it because trying to answer questions will just not help you because you have no context to understand heart failure in. But once you have a context from videos, and I know what heart failure is, I know what renal failure is, I know what sepsis is, then you need to do questions just over and over and over again and see all the different ways the exam might present you the material. And I think that's how, most students pass and get high scores these days is just by lots and lots and lots of practice questions.
Thank you, doctor. So we know that students are trying to practice as much as they can for the step one, step two exams, because after all, it's just like a huge step in our mind. It's really a step in our mind that we have to overcome. So speaking of that, doctor, for students who are dreaming of residency in the United States and things like that, what do you think is the thing they should understand as early as possible to do that?
Sure. I'm no expert on international medical graduate matching into the United States, but I do talk to a lot of schools with students from countries outside the US. And so, a couple of things I'll share with you that are my observations. I mean, the first of all is you should know the United States needs international medical graduates. Despite what you may read, we need doctors from other countries. There are not enough United States graduates to fill all the positions. So we're so grateful that people, well, most of us are, I am, that people from other countries come to the United States to train and to sometimes stay and practice medicine. The second thing is it is more difficult. Training programs in the US preferentially accept US medical graduates and US citizens. So, you will always be up against that. But then the last thing I'll have to say is there are so many different paths to the United States, and it varies by country. There are certain things I've heard students say work for them who are from Ghana, and different things I've heard students say work for them from India or Pakistan. So really, what I think the best advice I have for you is to find someone from your country and your medical school who has come to the US before you, who did it last year or 2 years ago or 5 years ago, and see if you can follow in their footsteps. Because often the people that come to the US are willing to help people years behind them. So they can tell you how they did it. They can tell you what people they talk to for advice. Also, programs that have taken students from a particular country or a particular medical school outside the US, if that student does well, they will look to take more people from that university and that country because they know that they did this once or twice and it was a very good experience with the trainee. So finding someone at your school who has gone to the US and finding out what they did and trying to follow their trail is the best advice I have for foreign medical graduates, especially because the paths are so different from so many different countries.
Thank you, doctor. Um, so, doctor, I guess for students who are international students, we have this like stereotype that we should have the highest scores to like overcome everything and get the match and residency in the United States. So, I just want to know this: what makes an IMG applicant stand out when he applies for anything that he wants in the United States? What makes him
Yeah.
stand out?
High scores definitely help. Research publications help. Knowing someone helps. So if someone at a program can vouch for you, that they know you personally and you are a hard worker and very diligent and good with patients, that will help a lot too. But honestly, at the University of Connecticut, the internal medicine program there routinely took foreign medical graduates. And they tended to come from the same cluster of schools where they had a relationship. So there were almost every year there were a couple students from the Philippines. There was a particular medical school there that had where a student had come over to the U.S. She had done really well, become a chief resident. She advocated for her school, and so the next year and the year after, they took students from that school. So if you were applying to the UConn program from that school, you had an advantage. If you applied to other programs from UConn from the Philippines, you might not have an advantage because if they have never taken anyone from there, they may not know how much they can trust the reputation of the graduates of that school, and they may have other schools they prefer anyway who get a leg up. So, really, I can't emphasize enough to find someone from your geographic region, from your school, and find out what they did, what were their board scores, what did they do for research, and find out where they applied and got interviews, and follow that like a recipe. Because really, internally at programs, this is true even for US graduates. There are certain programs that like certain medical schools. They've taken many students from them over the years. They know that when the dean says this student is a hard worker who will be great with patients, that they can trust that recommendation. And so they tend to have schools that they favor. And it's true for foreign medical graduates as well. There are places, sure, I don't know what they are, but there must be places where graduates of your school have gone in the last 5 years. And those are all like pathways that have been laid out for you to potentially follow.
Thank you, doctor. So, we have a lot of teachers, tutors, and lecturers who did the residency and match in the US. And we heard about their footsteps, and one of them was actually the score factor. Yeah, that's right. And a lot of other factors that you mentioned. But doctor, for students who are watching videos to get the scores factor, let's talk about it. So for the scores factor itself, so students who are using video resources, how could they use the video resources actively instead of just watching them passively?
Sure. Well, I mean, we built the Boards and Beyond QBank to convert the passive learning into active learning. So you can watch a 20-minute video where I teach you things, and then you will get questions directly linked to what I taught in the video. And it's always interesting to me, like I will say in the video, like I was just updating a video with some rare immunodeficiency syndromes, and I will describe them in the video. They present this way, they're caused by T cell problems. And then afterwards, we'll have a question that says a child presents with recurrent infections. Which disorder is it? And a third or sometimes up to a half of students will get it wrong, even though I explained it in the video. Why does that happen? That's because it's different reading it in a question than it is seeing it on the screen where I lay it all out for you. And in the video, I mentioned 3 different disorders, and you've got them kind of jumbled up in your head. So that active learning of answering the question will capture that third of students who are a little bit confused and straighten them out. So doing questions after videos is really a great way to turn passive into active learning. But I don't think passive learning is bad as long as it's not close to your exam. So, if you're taking the step 2 exam in 6 months, watching some videos to familiarize yourself with, management of shock or management of STEMIs, I mean, this is all good. This is good stuff to do. It will build your foundation. But as you get closer to the exam, you want to shift away from watching videos and shift your focus into doing practice questions, especially the MBME ones. Those are the ones you want to do like right before the exam. They're so similar to what's on the test. And they're not perfect. I have a YouTube series on my channel where I answer the free 120 for step 1. I have a little 3 to 5 minute video for each question where I explain to you how I attack the question. And that was really an interesting experience for me, going through all 120 of those questions. A few of them are flawed. I mean, I just think they're bad questions. They're poorly written. More than one answer could be right. That's going to happen to you on your test. You can't lose your confidence because of it. So practicing those MBME questions and getting used to them in all their good and bad parts is something you really want to do the few weeks right before the test.
Thank you very much, doctor. Doctor, we as students who are watching you, we all like the boards and beyond style slide and everything. It makes it really easy for us to understand and read and memorize and everything. So, Doctor, if we could summarize everything into one final boards and beyond slide, like if this session had one final board and beyond slide, okay, what would you want written on it for medical students who are watching today?
I mean, the thing about medical school is it's really a journey of getting to learn yourself. You really have to become honest with who you are. You're going to face stressors and you're going to feel overwhelmed, and you're going to have to find ways to overcome those frustrations. And these are things that are going to benefit you for the rest of your life. It's a different journey for everyone. Some people are bad at memorization, but better at process principles. That was the case for me. Some people memorize very easily, but they're frustrated by physiology and concepts. Some people have excellent interpersonal skills that help them in rotations. Some people struggle with that aspect. So it's a different journey for everyone. But you're really on the journey by yourself. No one can tell you exactly how to do it. But you have to find a way to just believe in yourself, accept these moments of failure. They are part of the process. They happen to everyone. Mistakes on exams, mistakes with patients, sometimes, unfortunately, mistakes that harm patients. These things are real and they happen to all of us. And so you have to take that journey to, learn all about yourself.
Thank you very much for your words, sir. If I may, there's some questions from our participants. So, Zain, can you start with the ones that you chose?
Yes, absolutely. So again, incredible. Thank you, Muhammad Raddad. Thank you, Dr. Jason. So we got on our Google form a lot of questions. So I'm gonna just tip on 5 selected the questions, and then we can open a Q&A for participants in case you wanna ask Dr. Jason Ryan before we close up the session. So one student who's Amal Hamdan from Al-Quds University asked, for those of us who have the opportunity to visit the United States each year for a few months, how would you recommend we use that time through shadowing or research to make the strongest possible impression on a U.S. residency application?
Yeah. I mean, again, I'm no expert in this, so I'm just giving you sort of my opinion from things people have told you and what I would do. But I would try to make a connection in the US with someone from your medical school. I mean, those types of individuals can be pure gold when you're applying. So if there's someone from your school who graduated 5 years ago, see if you can meet them for a cup of coffee or talk to them or shadow them and get them to introduce you to people who can help you match in the United States. I mean, nothing's going to be better than that. If you can't do that, then anyone who's willing to sort of take you on under their wing is worthwhile. But really, you want someone who you're confident is going to help you get into a U.S. training program and not just give you some work in their lab or let you shadow and then send you on your way and sort of forget that you were ever there. And the best opportunity is going to be someone who was in your shoes before.
Thank you, Dr. Jason. So we got another question from Omar Dunim from University of Batna in Egypt. So he's asking, many IMGs face long delays and real uncertainty in this process. He means the match process. What mindset do you think helped the ones who made it through keep going?
Yeah, that's a good question. I mean, there are lots of things in life that are hard to do. Matching in the United States from outside the US is one of them, but there are many other things in life that are difficult. And, like I said, it's an individual journey of medicine. You have to look at yourself and decide what you're willing to put up with and how hard you're willing to work for it. I don't think there's a feature that I can say all the successful students do and all the unsuccessful students don't do. There are people from various walks of life who have made it and who have not made it. But in general, the people that make it are, good students. They're personable, they have good English skills, and they work very hard to network within people who are connected to their country or university to help them get to the US.
Thank you. So we got multiple students who asked actually the same question. So many students want to know about what do you think, or how do you think AI will change medical education and clinical practice, and what should the students be learning today to keep it up?
Yeah, that's a great question. I think AI is going to make memorization a lot less important. It is so quick to look things up now that 30 years ago you might have been a superstar if you knew the enzymes in the Krebs cycle, but now you can look that up in a split second. So I really think more than ever, the age of thinkers is what's going to be favored in the future. I don't think you need to do anything about this right now, but just as you learn medicine, really try to think about why are we doing things. The AI will be able to tell you this patient has pneumonia, give them this antibiotic. I mean, and the AI will be able to tell you that in the future, and people are going to be less willing to pay you to provide that information. But how do we know they have pneumonia? What's special about their situation? Why do we give this particular drug? What alternatives are to these drugs? I mean, these have always been the thing that, in my opinion, distinguished the best doctors, is that they weren't just following a recipe. They were really thinking. And you mentioned in the way I teach, I mean, I never like to memorize things. I like to understand things, and that made it easier for me to remember what I needed to remember. And I think that's just going to be more true than ever. If you just want information, algorithms given to you, they're going to come faster and faster and faster in the future. But people who can really think through a complex case and navigate the non-scientific parts. I mean, a huge part of my job in cardiology was not medicine. It was interacting with patients and families and trying to help them understand and sometimes make difficult decisions around end-of-life care. I mean, these are things that I think is going to be very hard for an AI to do. And so just focus on that, being a thinker, a compassionate person, a good people person. I think this will always hold value. I don't think there's much you can do about it now. I mean, in residency, you just have to learn medicine. That hasn't changed, and that's always going to be the case. But as you are learning it, look for those role models who are really thinking broadly and understanding more deeply what's going on, and try to model yourself after them.
Thank you, Dr. Jason. So we are going to open a live Q&A with participants. And please, if you want to ask Dr. Jason Ryan, raise your hand. So, and yes, we can start with Laith Laham. You can unmute yourself and start.
First, I would like to thank you for your time, Dr. Jason. It was really an amazing experience to interact with you and hear from you personally. You've said that memorization in the future and now, its importance will decrease because with the advancement of AI, we will depend on it more and more. And as you said, the best doctors are the ones who can do the differentials from every aspect, treatment or pathological. But as you know, with the social media of today, YouTube and all these people like posting videos about methods of studying, active recall, spaced repetition.
Yeah.
I'm talking about these in particular. I hate studying. I hate memorizing personally. Okay, but unfortunately, in medicine, like there's a lot of information that you just can't only understand, but you must memorize. And I don't know about any I don't know about any other people, but I personally tend to forget a lot because there's so much information. I don't know how people keep it up, honestly. So in a pragmatic way, in a practical way, if you can please explain how you studied or the best way to study in order to retain the most and forget as less as you can.
Sure. Yeah. I mean, unfortunately, the step exams are still heavily steeped in memorization. They still, a good score requires you to just have lots of factoids memorized. Not every question is like that. Some of the questions are good questions where you really have to apply logic and think, but there's definitely a significant number of them that you just have to have a certain enzyme memorized or a certain vector memorized or something like this. So for the step exams, you're going to have to memorize and regurgitate this information on the exam, and you will forget it shortly after. Like I said, I don't think this is a very useful skill in the modern era. 50 years ago, when to look something up took hours of going to the library and looking it up, it made sense that we force students to memorize things. But really in the last 20 years, that hasn't probably been necessary since smartphones came out. But the board exams are still steeped in that, so you're going to have to do it. When I was in med school, I made lots of flashcards, and I can see the draw of Anki. Anki came out obviously way after I had graduated, but the idea of Anki is just to simply, I used to have flashcards and I would show it to myself and it would say, what murmur is this? And I'd flip it over to see the answer. And if I knew it, I put it in one pile. If I didn't know it, I put it in a different pile that I would see it again quickly. And that, to my understanding, that's basically what Anki is. It's basically sorting, you tell it how hard the question was and you sort it into different piles. I think you can use whatever method you want, but I can't emphasize enough though how much I think understanding first is key. Memorization is a late thing, closer to the exam. If you memorize, names of enzymes 6 months before your step exam, you will just forget it. It's really a waste of your time. So when you're that far out, you just want to understand what is the Krebs cycle all about? What is this different? What causes this disorder? What are the symptoms of it? How's it classified? How's it treated? Broad principles. Closer to the exam is when you can start saying, okay, I want to memorize all these various things. I took the echocardiography boards for cardiology, and it had a lot of physics equations on it about sound waves and things like this. And about a month after the exam, I found a review book I'd used. It was in my car under the seat. And I opened it and I'd circled an equation and starred it. And for the life of me, I thought I'd never seen that equation before in my life. But obviously I had because I'd circled it and started. But that's what happens when a month goes by, or maybe it was 6 weeks since the exam. I had completely forgotten it. And so this is going to happen to you with a lot of these little factoids that you learn. I mean, I remembered that sound waves are important for echocardiography, but I couldn't tell you the equations. And the same thing will happen to you. You'll remember that, gram-positive bacteria are important clinically, but you'll forget the names of the molecules in the cell membrane. So, closer to exam, that's when you pound memorization. And that's where the practice questions help too, because if there are gaps in your memorization, the practice questions will expose that.
Okay, thank you very much.
Thank you. So going to Laith Malla, you can go ahead.
Hi, Dr. Jason. Thanks for the amazing session. It was truly inspiring. I have mainly two questions. First of all, you as Dr. Jason, when designing the slides and like recording your lectures, what do you expect from the watcher who's like watching your videos to do afterwards? Like, do you expect them to look again at the slides, do questions, or maybe review your videos weekly? What is the algorithm behind learning your videos?
Yeah, I mean, if I'd had videos like Boards and Beyond when I was in med school, I would have taken notes as I watched. That was my style. I recommend it. That's not for everybody. You don't have to do that. There are other ways of learning it, but I would have taken notes, done the practice questions afterwards, and then reviewed my notes a few days later. And if something didn't make sense, I might go back and watch the video again. It depends on the topic. I mean, honestly, some topics are very straightforward, and watching the video once is probably enough. Other topics, pulmonary physiology, cardiac physiology might be more confusing. Brainstem lesions of strokes, you might want to go back and watch those videos more than once. So it kind of depends. I don't really have an expectation of what you should do because everybody's different. But in general, I tell people try to make sure it's not pure passive learning, by taking notes or paying attention and doing the questions, and then going back as you need to.
Okay, thanks for your answer. My second question is, you previously mentioned how important are the IMGs for the US healthcare system. So, from the perspective of a healthcare practitioner in the US, what unique qualities or strengths do international medical graduates bring to the healthcare system, and why are they still highly recruited?
I mean, I think I'm a believer in diversity, and I've trained with people from so many countries, and I've learned so much from them about how they trained. One of my closest friends in fellowship was from Ireland. I learned so much from him about how the national health system works there and how they practice medicine. I've trained with fellows and residents from Jordan and India and Pakistan and learned amazing things from them. So I think anyone who brings an international perspective, adds to the sort of rainbow of interesting things that you can experience working in the US medical system. But beyond that, mostly we want you to be good doctors. I mean, I think that's what we want from American graduates and international graduates. We want people who are bright, who know medicine, and who can communicate well with patients.
Okay, thank you. These were my questions.
Okay, so we got a question in the chat from Dima Al-Muhtasab. So Dima is asking, what's one thing you genuinely wish every medical student understood starting from first year, something that would completely change how they study or approach medicine if they realized it early on?
Yeah, I mean, I wrote this satirical novel about medical school, which I shared you the link in the chat. And a huge point of that story I wrote was my perspective that the more you can tune out your classmates and the competition and just focus on learning how to be a good doctor, the happier you will be. It's impossible to go through medicine and never look to your left and right at what other people are doing. I mean, you're going to have to do that. But the amount of information on social media and from your friends in groups and chats and Discord forums can be overwhelming. And it can paralyze you. It can make your studying less effective. So, one thing I tell students early on is try as much as possible to stop comparing yourself to everyone else. It really is, the path to the dark side, to use Star Wars language. Like, the best students I've trained in med school, by and large, have tuned out the noise, and tried to just put their head down and study. They ask their classmates what resources they like and get suggestions, but they don't worry too much about how many Yankee cards they've done compared to their friend, compared to what they read on the internet, or how many UWorld questions they've gotten right. They're just grinding and doing their work. And especially in this day and age with social media, it is really important to develop that skill. It will carry you through your career because it never ends. There are comparisons in residency, there are comparisons as an attending. It just goes on and on and on. Learning to not compare yourself to other people and just take pride and have confidence in your skills and push forward.
Okay, thank you. So we got our last two questions from Ode. So his first question is, how do we balance learning medicine for exams versus learning medicine for real clinical reasoning and applying the skills?
Sure. Applying the skills and learning medicine for real is best learned with actual patients. I don't think you can really imitate it very well with board questions or practice standardized patients. It just nothing compares to the real experience of seeing actual patients. So mostly in your first 2 years, you want to just focus on learning the details of medical science. You need to know what heart failure is, what kidney failure is, how different drugs work, and things like that. You will learn the clinical side much more when you're out in practice. A lot of people don't realize this, but really the most important part of your training is your first 5 years as an attending after finishing residency or fellowship. I really was not anywhere near fully trained when I became an attending. I knew enough to practice independently, but I learned so much in those first 5 years because I was on my own and I had no one backing me up. And I was doing nothing but seeing cardiology patients from 9 to 5 every day who were my own patients. And you learn so much. And I've heard this from so many people, from surgeons, from ER docs, from psychiatrists. Really learning medicine is an experiential thing. It's hard to learn it from a video, from a Q bank, from a standardized patient. So in the beginning, I try to put in my videos little tidbits that will help you with actual patients and say, like, oh, if you see this sign on a patient, always think of this. And you should pick up those things. But really, the clinical learning is going to come with real patients later.
Thank you. So the other question is about the clinical confidence series of Boards and Beyond, which is a new series that came up recently. So when does you recommend watching them? Are they relevant for exams?
When do I recommend watching the videos?
The clinical confidence series.
Oh, sure. Yeah, that's a great thing to watch right before a rotation. So it's very different from the Boards and Beyond videos. It's not going to teach you how to get test questions right on the step 2 exam. But for example, there's an entire video on all the different types of intravenous lines we use on patients. That's something no one ever taught me. And I really didn't understand for weeks on end during rotations. They'll teach you about different sutures you'll use in the OR, different tools you'll see in the OR. So those videos are best watched like right before rotation, and you will just feel so much more informed on the rotation after watching them.
Thank you, Dr. Jason. Doctor, can we take 2 more questions, or like if we're short in time?
Yeah, no, I have time for 2 more questions. Sure.
Okay, absolutely. Okay. So we got Basil. Go ahead, Basil.
Hello, everyone. Dr. Ryan, we really appreciate your time. My question is, as a medical student, I found it recently a little bit challenging transferring from basic learning into medical training in the hospitals. So, do you have any advice for all of us who are new to this transformation?
Yeah. First of all, just know it's normal to find it hard. I can't emphasize that enough. Part of what is difficult in medical training is we all have a tendency to think that we're the only ones struggling and that everyone else must have it easy. But really, anyone who goes from the preclinical years of studying for step one in anatomy lab and then is out in a clinic seeing patients who came in off the street is going to struggle to adapt to that. So it's normal to struggle to adapt to that. So know that it's normal. Ask lots of questions. You can watch the clinical confidence videos if you want. But it just gets better. I mean, I see this all the time. Students at the beginning of their third year, which in the US is when they start clinical rotations, compared to those at the end of third year, there's an enormous difference. And it's just because they're just more comfortable sitting with patients or presenting on rounds or talking to an attending. Like everything in life, that stuff just takes experience and exposure.
Thank you. Thank you. You've been a true inspiration for all of us.
Thank you, Basil. Thank you.
Oh, true. So going to our last question with Arij. Go ahead, Arij.
Hey, Dr. Jason. Thank you for your lecture. Now, I think you've talked about how you shifted your career from engineering to medicine. Now, my question is, do you have any advices if someone have some opposite thoughts? Like maybe they think the medicine is not the best place for them if they have a lot of passing some sympathy and empathy with their patients that might affect their lives or causing them to burn out. So if you can talk about more about shifting careers and I don't know, any advices.
You mean like people who burn out in medicine and want to shift careers?
Yeah. Or they
Yeah,
have a lot of sympathy and empathy for their patients and they just keep thinking about them and that might affect their life in a negative way.
yeah. That's a good question. You can't be completely cold to your patients or you'll be a bad doctor, but you also can't, cry endlessly with every patient who experiences something sad because that won't let you do your job. So I think that comes with practice from years of patient care and honestly from talking with your colleagues. I mean, when I was in training, we spent a lot of time talking about difficult cases, sad cases. Many people went to therapy. I went to therapy at times. This is all normal to struggle with those things. And so, don't be too hard on yourself. And usually, as people go on in their career, they find a way to manage it, to still be sympathetic and caring to their patients, but not be so pulled in that they can't do their job.
Okay, thank you, doctor.
So, Dr. Ryan, we have reached the end of our time together. So I think everyone here would gladly stay for another hour. So on behalf of every student who joined us tonight from across the Arab world and on behalf of the Cardiology Interest Group of Jerusalem, I want to express our deepest gratitude. You did not have to say yes to a group of Palestinian students in Jerusalem. The fact that you did means more than you know. Boards and Beyond has been part of our journeys as medical students and as part of my journey personally. And it's like I told my friend like a couple of years ago, a friend of mine, like, I told him that one of my dreams is just to meet Dr. Jason Ryan personally, because I can't emphasize enough how you transformed my life in medical education. And in general, I even follow you on Twitter and see like everything that you post and etc. And it's really insightful, not only for medical education, also how to manage our lives. So Boards and Beyond, yes, has been part of our journeys as medical students. And tonight, you have become part of our story as an organization. For our participants, the recording of tonight's session will be made available on our YouTube session. And thank you for being here. Thank you for your questions. And thank you for your energy. This is what CARDIG-Jerusalem, the Cardiology Interesting Group Jerusalem, is for. Dr. Ryan, thank you so much. We are so grateful for this unique opportunity. And yes, that's it. Thank you. Thank you so much.
Thank you very much for those kind words, and thank you for having me. I love all you guys. All I want is for you to become great doctors and achieve your dreams. So I love meeting with you. I hope it happens, and I hope we get to meet someday too. I've always wanted to come to. I've never been to Israel. I've been to Dubai, but I've never been elsewhere in the Mideast. And I would love it. And I hope someday our paths cross. It would make my day too.
You are always welcome, Palestine. We'll be so happy
so
to have you here with us.
Great, thank you.
Thank you so much, Dr. Jason.
Best of luck to all of you. Okay.
Thank you, Dr. Jason.